Hello, uh, good evening everyone. Today I am going to discuss about evaluation of premenopausal female, premenopausal female with AUB. Okay, that means of a female of more than 40 or 45 years old with AUB, if she is coming, then what to do? First, we will take history and physical examination. History and physical examination. Then you'll do pregnancy test because we should rule out pregnancy. So pregnancy test, if it is positive, then you'll do disease specific management. If it is negative, then we'll do few investigations like CBC with platelets mainly. Okay, why platelets? Because during menses the basilar artery get bleed, it clots because of platelet aggregation. If platelets are low, then there is no platelet aggregation and she will continuously bleed. So to rule out that, we are doing this platelet count. Then you do TSH. Then you will do coagulation profile. Coagulation profile also, if the history, whatever the history we have taken, if the history suggests any coagulation disorders, then you will do this test. Prolactin. Okay, prolactin also, if the history says like there is breast milk discharge, headache and all, then you can go for prolactin. Okay, then you go for testing of gonorrhea and chlamydia, and also you will take pap smear plus HPV testing. Okay, these investigations are done. If any of these investigations are positive, then you will do disease specific management. Third is you will do TVS plus Doppler. Okay, one exception is if this female is bleeding heavily, heavy menstrual bleeding is there, and there is no availability of ultrasound, then you directly go for endometrial biopsy. Okay, so on TVS ultrasound you can find leiomyoma, or you can also find adenomyosis. In this also there is abnormality and bleeding. Okay, so you will treat accordingly. If on TVS there is focal lesion, like on ultrasound you are having some focal lesion, then you should go for, it can be polyp, so you can go for saline infusion sonography or directly go for hysteroscopy. Okay, if on TVS there is abnormal endometrial thickness, if on TV or if the history shows that she is high risk, mainly these two are very important. Okay, for these two patients we'll do endometrial biopsy. Okay, if the TVS shows normal endometrial thickness but there is AUB, then we'll go for medical treatment. Okay, medical treatment like progesterone therapy. If you give medical treatment, then we'll follow her. Okay, so what is this high risk patient? If the female is more than or equal to 45 years age, okay, nulliparity, PCOS, diabetes, obesity, and if she's having tamoxifen use, if she's having genetic disorders, okay, all these conditions comes under high risk. So on history, if any of these features are seen, then she's high risk. Then you on TVS Doppler, if it is normal endometrial thickness also, you will go for endometrial biopsy. So endometrial biopsy, if the finding shows hyperplasia, okay, endometrial biopsy shows hyperplasia, then you will treat accordingly. If the endometrial biopsy shows polyp fragments, then there is remained polyp inside the cavity, so you should do that. Hysteroscopy, DMC. Okay, if the endometrial biopsy shows like insufficient sample, then also histo-DMC. If the endometrial biopsy shows no cancer, no hyperplasia, okay, no hyperplasia, even then the symptoms are present, then also you do hysteroscopy, DMC. So these people are there with normal endometrial thickness for having medical treatment. If this fails or if it is good for some days, again it is recurring, then also you go for hysteroscopy, DMC. So this is a management of like algorithm for evaluating a premenopausal female with AUB. Again I am repeating. First you'll take the history and physical examination, then you'll do pregnancy test. If it is positive, then disease specific management. If it is negative, you'll do all these tests. If it is any of these tests are positive, then you'll do this disease specific management. For example, if chlamydia positive, then you'll give treatment according to that. Next is transvaginal ultrasound plus Doppler will do. In this they will have any fibro, leiomyoma, adenomyoma treat. Focal lesion, do histoscopy. Abdominal endometrial thickness, high risk patient, you do endometrial biopsy. Normal endometrial thickness, you do medical management. If it fails indica, you do histoscopy DNC. Okay, what are the high risk? All these: obese, diabetes, PCOS, nullipathy, age, preventive induced genetic disorders. These are all high risk. On endometrial biopsy, if there is hyperplasia, treatment. Polyfragments or insufficient, you will do histo-DNC. No cancer, no hyperplasia, but symptoms of AUB are present, then you will do histo-DNC. You want a normal endometrium, if the treatment fails in liquor, you will do histo-DNC. Okay, thank you.